Laska Hirlock, I too want to welcome the Minister into the House this afternoon and thank her for joining us today. Also want to thank the Cathaoirleach for selecting this commencement matter. Willow Community Services Counselling was founded by Seanad Malloy in 2018. It is managed by a dedicated board of directors, and I just want to put on the record again, Laska Hirlock, that I am one of those directors. The reason I'm asking for additional funding today, Minister, and you've come in before us the House, is that I attended a board meeting last Thursday night to be told that the money is running out. And basically, if we don't get additional funding, then we have only enough funding to last for another couple of months. I want to put on the record as a board member, and indeed the Willow would like to put on record that they're extremely grateful for the €47,500 that they have received from the HSE already this year. Willow have put that to very good use, making a direct and indeed a significant impact in Athy and in the greater Athy area this year. Minister, like many towns of its size, Athy, my hometown, has seen an increase in those needing assistance, help and advice with drug addiction. Without additional funding, Willow will, as I said, have to close its doors in the coming weeks, which will have a detrimental and devastating effect on those that are calling into the doors of Willow in ever-increasing numbers. Willow is the most effective local service in Athy, building on a trust that Sharon and her team have built up over the last number of years. This trust has reached many within the community who previously, Minister, never engaged, kept to themselves outside and shunned any previous attempts to help them. A number of years ago, Willow predicted a growing, unfortunately, crack cocaine problem, not just in South Kildare, but throughout rural towns and communities throughout the state. And unfortunately, that prediction has come true. Those treating crack cocaine will tell you that there is no clinical substitute for it, which makes clinical detox problematic, as the client needs to cease using crack cocaine first. This is why we need to fund established schemes like Willow, who have proven that they can get to those that need our help most, and over the last number of years has established a trust where 80% of its clients come through the door through word of mouth. In those short years since it was established, Willow has seen over 100% increase in the hours needed to reach out to those that need its help most. It has seen the need for the group to find and relocate to a new premises, offering more room and more privacy to treat those who need assistance at this time. This new premise can now accommodate group therapy sessions, another very important step on the road to recovery, as you may know, Minister. However, without the necessary funding, Willow will not be able to progress to this important step in what they can offer and what they can reach out to people to help. I've spoken, Minister, to a number of people who've been through the doors of Willow in confidence over the last number of weeks, and the one issue that comes back is the life-changing experience that they've experienced using Willow services, such to the extent that they now are offering to actually fundraise to keep the doors open, because they say they don't want anybody else to lose out on the wonderful service that they've got. They want anybody that needs the services to ensure that the services are there, and they're organising fun walks, they're organising golf classics, fishing classics, I've heard last Thursday night, and that's what's happening. I do hope, Minister, that you do bring some good news with it to you today. Athy and South Kildare has its problems, but those problems are in other towns and communities across the state at this time. We are told by those in the know that drug use is a coping mechanism for trauma. We have a service that is working in Athy and South Kildare, a service that is growing, and most importantly, Minister, a service that is needed. There is no need to set up another service or even start again. I do hope government recognise the importance of this service in the area where I live. I do hope, as I say, Minister, that you come with some good news, because Willow Community Services have made a difference to Athy over the last number of years, and all you've got to do is come to Athy, and you're most welcome at any time, Minister, and talk to those that have been through their doors.
Thank you very much, Senator Wall. Minister.
Thank you, Laska Hirlock, and thank you, Senator Wall, for raising this. And indeed, I mean, this isn't my area of responsibility, and I'm here on behalf of another minister, but I would actually very much be interested in going to see the services provided, and it's extraordinary the commitment that community group and the drive of individuals and the community support can bring to a particular matter, and Sharon Malloy is to be commended, as you all are, for the work that you're doing and the intervention that is being made. And I know that Willow Counselling, it's a broader approach than simply diagnosis and treatment. There's the really important part of mental health counselling and addiction counselling, without which no long-term effects can be achieved. And I appreciate that that's the approach. It is suggested to me that precisely because of that, that the HSE suggest, or that the Department of Health suggests, that because Willow Counselling covers a number of different disciplines, including substance use, mental health, and because they cater for young people also, that there are broader streams of funding that may be available to them, including HSE Mental Health Services, TUSLA and other organisations. And I do wish that this was my own area of direct responsibility, that I could provide a deeper answer to you today, and I apologise that that is not so. I do know that Willow Community Council was in receipt of public funding of, I had understood 40,000 a year, you have said 47,500 a year under the grant aid agreement. I'm also aware that it received €15,000 in December 2022 and one-off additional funding for the provision of extra counselling hours. And I hope that that has been useful, but it may have also shown the path of quite how useful it is and how much more needs to be funded, and I'm aware of that also. As you're aware, Minister Naughton and Minister Butler, Minister Naughton has published the Strategic Action Plan for the implementation of the National Drug Strategy for 2023 and 2024. That plan has a total of 34 actions based on the 6 strategic priorities following the review of the strategy in 2021. But that only matters if those concrete actions actually make a measurable difference to the lives of people affected by drug use. One of the 6 strategic priorities is to enhance access to and delivery of drug and alcohol services in the community, exactly as you have described. And that priority seeks to enhance community care, which is the important place to get it for people who are using drugs, by providing health and social care services at the community level to meet the identified health needs. So, in that sense, the Department of Health is very aware of the important role that organisations such as Willow Community Counselling play under the drug strategy in assisting individuals and their families cope with mental health and addiction issues throughout counselling services. There is a commitment of the HSE Addiction Services to strengthen links with Willow Athy to support those presenting with drug and alcohol issues, but the Department does also suggest exploring those additional streams of funding, which I'm sure the Board has already considered and may in fact be activating at this point. And I might answer further in the response.
Thank you, Minister. Senator Wall.
Well, thank the Minister. I do appreciate that the Minister is not coming directly from the Department, but I do appreciate her response. And you've hit one point that I would like to take up, and that's the families that are affected, Minister. This is one of the areas that Willow would like to explore more. That's one of the reasons that we've accommodated a new, or went to a new premises to accommodate the room and accommodate families, to bring them in, as you said, rightly so, in relation to the care that's needed for people at this time. So, I appreciate that you're saying to us that we need to go back to the HSE as a board. We will do that, but I would hope that you would also put word in following our conversation today. And the most important thing I can say, Lascahirlock, is that Athy needs Willow, Willow needs Athy. We need to keep those doors open, and the couple of weeks that we have left, it needs to be extended. So even if we had another temporary funding that you mentioned previously, which all money has been very well spent, that would be much appreciated. But I would appreciate if you brought that back to the Minister, and I do appreciate you turning today. Thank you very much, Lascahirlock.
Thank you, Senator Wall. Minister.
I can assure the Senator that I will do that, that I understand that in order to have real impact, the support of families is absolutely centre to the approach that has to be taken. The community-based drug and alcohol services are a key part of the National Drug Strategy in assessing the extent and the nature of the drug problem, but really getting at the issues behind the drug problem, which are often extremely complex, as the Senator is aware better than I am, being a board member of the Willow Community Counselling Centre. The complexity of the challenges associated with improving outcomes for people with co-occurring mental illness and substance misuse problems or dual diagnosis is recognised in both the mental health policy, sharing the vision and reducing harm, supporting recovery, and the National Drug Strategy. But recognising that no single service can cater for the diverse needs of service users with dual diagnosis, you've got to improve the overall structure, and Willow Community Care is exactly in that space. So it's very clear to me that the model of care that is provided there as part of the dual diagnosis programme, it has been clear that a model of care which describes a clear clinical pathway for all adolescents and adults suspected of having that dual diagnosis that are supported through an integrated approach through primary care, substance misuse, community mental health and acute services.
Thank you very much.